Imagine waking up one day feeling tired, bloated, and a little off, only to find out it's because your liver isn't working properly. You might think it's just a passing phase, but the truth is that fatty liver disease can go unnoticed for years. It's silent and often presents no clear symptoms. It's not just about alcohol, it can happen to anyone, and the signs are often hidden. Could your liver be trying to warn you? Fatty liver disease is more common than you might think. In fact, it affects nearly 25% of the global population. But here's the silver lining. It can often be reversed. Early detection is key, and knowing the signs can be your first step toward better health. In this video, we'll uncover the 10 shocking signs of fatty liver disease. Not only that, but we'll also dive into how you can naturally support your liver and take control of your health. So, let's get started. 1. Elevated liver enzymes. One of the earliest and most reliable signs of fatty liver disease is the elevation of liver enzymes, specifically AST and ALT. These enzymes are responsible for helping your liver break down fats and detoxify the body. When your liver is under stress, it releases higher levels of these enzymes into your bloodstream. What you may not realize is that high enzyme levels can be detected through a simple blood test. If you're feeling fatigued or dealing with unexplained symptoms, this test can provide crucial insights into your liver's health. The more you know, the better equipped you'll be to take action. Elevated enzymes are a warning sign that your liver is not functioning properly. It's an early clue that you need to pay attention to your lifestyle and health. A high AST or ALT reading is often the first signal of non-alcoholic fatty liver disease, NAFLD, which could progress to more serious liver damage if left untreated. 2. Extreme fatigue. Fatigue can feel like a common part of life, but when it becomes overwhelming and persistent, it could be a sign of fatty liver disease. The liver plays a major role in energy metabolism. It helps convert food into energy your body can use throughout the day. When the liver is burdened with excess fat, it's less able to do this efficiently, which can lead to extreme tiredness. Studies have shown that people with fatty liver disease report feeling constantly drained, even after a full night's rest. If you're noticing that you're more tired than usual, and it's affecting your ability to perform everyday tasks, this could be your liver signaling that something is wrong. It's important to take this seriously, as fatigue can often mask more serious underlying conditions. 3. Abdominal pain and swelling. Another sign you may notice is discomfort or pain in the upper right side of your abdomen, where your liver is located. As fat accumulates in the liver, it causes inflammation, which can lead to tenderness or even sharp pain in this area. In more advanced stages, liver enlargement might also lead to swelling. Fluid retention, or edema, can occur when the liver's ability to process proteins and regulate fluid balance is compromised. Swelling might start in your abdomen, but can spread to your legs and ankles as well. If the pain becomes more intense or starts to affect your daily life, it's crucial to seek medical advice. The earlier liver damage is detected, the better the chance of recovery. 4. Appetite and weight changes. One of the most surprising symptoms of fatty liver disease is changes in appetite. Some individuals experience a loss of appetite, while others may start losing weight unintentionally. This can be attributed to the liver's role in regulating hormones like leptin, which controls hunger. When the liver is overloaded with fat, it disrupts hormone balance, leading to changes in appetite and metabolism. This can result in unexplained weight loss, which may seem like an unexplained issue, but it's closely tied to liver health. If you're noticing an unexpected weight change or a constant lack of appetite, it's worth having your liver checked. Supporting your liver through dietary changes can help restore normal hormone production and balance your appetite. 5. Digestive issues. Fatty liver disease often affects digestion. Many people with this condition experience symptoms like bloating, constipation, or even diarrhea. These digestive issues occur because the liver is integral to the digestion process. It produces bile, which helps break down fats and absorb nutrients. If the liver isn't functioning properly, it can disrupt digestion, leading to bloating and discomfort. Some individuals also experience changes in their bowel movements, including diarrhea or constipation. If digestive issues persist, and you're also dealing with other symptoms like fatigue or abdominal pain, it may be time to consult with your healthcare provider for further tests. 6. Nausea and acid reflux. Nausea and acid reflux are commonly reported by people with fatty liver disease. Your liver plays an essential role in detoxification. When it's not functioning properly, toxins and waste products build up in the body, including the stomach. This can lead to nausea and the sensation of heartburn or acid reflux. This is when stomach acids start moving backward into the esophagus, causing discomfort and even vomiting in some cases. Acid reflux is more prevalent in those with liver disease because the liver's inability to detoxify properly impacts other areas of the body, including the stomach. 7. Unexplained bruising or bleeding. A surprising sign of liver disease is unexplained bruising or bleeding. The liver is responsible for producing proteins that help blood clot. When liver function is impaired, these proteins aren't produced as effectively, which leads to easy bruising, even from minor bumps. In more severe cases, people with fatty liver disease may experience spontaneous bleeding from small cuts or wounds that are difficult to stop. If you notice that you're bruising more easily or bleeding for longer than usual, it's important to seek medical attention as it could be a sign of liver dysfunction. 8. Jaundice, yellowing of skin and eyes. Jaundice occurs when the liver is unable to process bilirubin, a waste product generated by the breakdown of red blood cells. This causes a yellowish tint to the skin and eyes, signaling liver distress. Jaundice is typically a sign of advanced liver disease, but it's crucial to address it as soon as possible. If you notice yellowing of the skin or eyes, contact a healthcare provider right away. Early intervention is essential for managing liver disease. 9. Itchy skin. Itchy skin, particularly on the palms of your hands and soles of your feet, can be a sign of liver disease. This happens because when the liver isn't functioning well, it can't properly filter bile acids from the bloodstream. These bile salts then accumulate and irritate the skin, causing persistent itching. If this itching worsens over time, especially in conjunction with other symptoms, it's time to get your liver function checked. This could be an important indicator of liver distress that needs immediate attention. 10. Swelling in the legs and ankles, edema. Finally, swelling in the legs, ankles, and feet can also be a sign of fatty liver disease. When the liver is not functioning properly, it struggles to process fluids, which leads to fluid retention in the lower extremities. If you notice swelling that doesn't go away after resting or elevating your legs, or if it's combined with other symptoms like fatigue or abdominal discomfort, it's important to consult a healthcare provider to rule out fatty liver disease or other liver-related issues. If you've noticed any of these signs, it's important to take action now. Fatty liver disease can often be reversed with the right changes in diet and lifestyle, but the key is early intervention. Regular exercise, limiting alcohol, cutting down on sugar and processed foods, and eating more fiber-rich foods like fruits, vegetables, beans, and lentils can support liver health. Remember, there's no need to panic. Stay calm, take the right precautions, and consult with a healthcare professional. Your liver health is essential, and with the right steps, you can restore it to its optimal function.